And hello, everyone. That's right, I'm back. Welcome back to OAFP Bite-Sized Learning. I'm Mike Sevilla, your OAFP President. And we have a great guest coming up with a very important topic. But first, I have some OAFP-related announcements that you can all get at ohioafp.org. First, the registration for a family medicine workshop is open, and you can get 18 live prescribed credits from the comfort of your own home. They are January 16 and 17 and January 30 and 31. You can take one, you can take both, you can take the first one, you can take the second one. Very flexible. You can go to the website to check that out. Very popular program. And hey, you can get credits in January. How about that? Next, we're coming to the end of the year. So, I want you to really remember organizations like the OAFP Foundation as we're closing up the year and it's getting to be holiday time. And did you know that you can donate to OAFP Foundation while you're making your Amazon purchases? That's right. So you can go to smile.amazon.com, and then you have to click, and then you have to find OAFP Foundation, and then you can make a donation that way while you're making your purchases. So, and finally, announcement. So we've had our first racial equity book club already. And if you don't know what that is, it's a safe and respectable virtual space to discuss important literature on topics of social justice and health equity, all from the comfort of your home or office. Guided conversations provide unique opportunities for insightful reflection and open-minded sharing with your peers. So this has been a very interesting and great component that we've been trying to share with our members. The next book club is going to be on January 14, 2021. And you can get more information at ohioafp.org. So without further ado, I'm going to bring in our guest, my friend, Dr. Mark McLoney, the medical director for MetroHealth, LGBTQ+ Pride Network in Cleveland, Ohio. So Mark, thank you so much for being here tonight.
Thanks for having me, Mike. I guess I can give myself a quick little introduction for anybody that doesn't know me. I actually grew up in a small town called Norwalk, Ohio, just a little bit west of here, and I can ask a question on that like I always ask my medical students, but we'll get to that later. I'm a second-generation family practitioner. My father was a family practitioner. My mother was a concert pianist. So I, of course, have an undergraduate degree in theater arts from Denison University.
Nice.
My master's in human genetics from University of Cincinnati. And then I went to medical school at Medical College of Ohio in Toledo, my residency in Altman Hospital down by Canton. And then I've been a practicing.
It's not by me, so I know exactly where that is. It's a great program. It's a great program.
It's a terrific program. It was a great experience for me. Had a lot of Yoders as patients, a lot of big arm communities there.
That's right. That's right.
And then I've been practicing in Cleveland for about 30 years now. The vast majority of it has actually been in private family medicine. And then I joined Metro Hospital about 4.5 years ago.
Wow. And I asked all my guests this, Mark. So, I mean, you've had an influence on already, but why family medicine? When you talk to people, especially when you talk to medical students and people in the community, why is family medicine important? Why are family physicians important to you?
Well, when I was doing my master's degree, I found out that the MDs had more power and more influence than the PhDs or the MSs did. So I actually went to medical school to become an MD so that I could do my genetics. And once I was in medical school, I fell in love with everything I was doing. I loved the family care. I'm sure it was influenced by my father being a family physician and knowing his partners, one who was much older, who used to go out to spend time with the family as someone was expiring and that type of thing. But it's just, you get to do everything. I mean, one of my most favorite moments was I had a baby in the nursery, and I went in to see the baby, and I had someone else I had to round on.
Wow.
And I saw the baby, and I went in to say hi to the parents. Both parents are patients of mine. The grandparents were there. They were patients of mine. And the other patient that I had to see was the great-grandfather of the baby. So it was just this really great family moment. I just can't say enough about it.
That's great.
It's so good. It's so good.
Yeah, it's just great for me just hearing different family docs just kind of sharing their story, how they got to family medicine. But to kind of switch gears, I mean, you're the director of this clinic, and I guess my next question for you is, why is this work important to you? Why is this LGBT work important to you?
Well, years ago when I was in private practice, I have a good friend who is a therapist in town, and he does a lot of LGBT care. And he was looking for a family doctor or a doctor that would take care of his patients without judging them. And he goes, "Can I send them to you?" And I'm like, "Of course, be my guest." And he sent me a patient who was sex assigned at birth as a male, and I saw this person as a male. We did depression meds and attention deficit disorder and blood pressure. We did all the health screenings and that type of thing. In my 6 to 12 months working with this patient, they transitioned, and she is now a very lovely woman. And that just really triggered an interest. This population is so ignored, so misunderstood. It's actually kind of disheartening sometimes when a patient looks at me and says, "You don't know how much this means to have a physician that I can talk to about all this," and just accepts me. I'm like, doctors should just accept you, period. They should listen to you and want to take care of you. And that's what I always tell my students at Case. Your patients come first, listen to them, work on their needs, and they'll tell you what they need to do. So, but that's what really got me interested in this group. I'm also part of LGBT. I've been with my partner for now almost 30 years, and we've been together. So it's nice. I've done lots of talks with just G population on safe sex and other health issues. And this population tends to get very poor preventative care, especially with lesbians and just regular typical well woman care, because they're nervous and they're afraid and they don't feel comfortable talking to their doctors. So,
right. And we were talking, before the program that I think maybe one of your first patients, they were seeing like an endocrinologist. It was kind of like in that territory. And then can you share a little bit about that?
Well, that was that patient I was talking to you about that started with me, and I went through the whole transition. And she's still a patient of mine. I still take care of all of her family primary care needs. And she came in to see me probably about a year ago and said, "Oh, my endocrinologist retired. Can you refer me to another endocrinologist that can do my hormones?" And I said, "If you are comfortable, I can take over that care." And she looked at me, she goes, "Are you kidding me?" And I'm like, "No, I can take care of that. If we get into troubles, we refer out to specialists, but no, I can do that." And she goes, "That would be great to have all of my care on one place. And my doctor is the doctor that takes care of everything and knows all the blood work." I'm like, "Yeah." So she was very surprised, very much like a lot of my patients when I first moved to Cleveland that were surprised that I took care of kids and adults.
Right. Exactly right.
Yeah.
Right.
Yeah.
So how did you, do you need a certain certification for this? How did you educate yourself on, like specific medical needs for this population?
Well, I have a great interest in this population. When new doctors come into our clinic, we usually do shadowing where they follow along with the doctors there. We have lots of information that we give out. We follow the guidelines set forth by the Centers of Excellence for Transgender Care for our transgender individuals. And then just lots of reading and an interest in this group. There's really no certification yet for it. At Metro, we are trying to organize a clinic that will eventually be a show place in the sense that people can get every kind of care there and we can take care of it. We have other entities in Cleveland Clinic, University hospitals. I'm friends with people at both facilities. There's enough patients to go around. This patient population needs cared for. And kind of like Miracle on 34th Street, it doesn't matter if it's Macy's or whatever the other department store was. I just want to make sure they get the care. And we talk with each other. We share cases. We talk, and sometimes because of the insurance, they have to go to Cleveland Clinic or they have to go to Metro. And it makes it very easy that there's a nice transition there.
So for people who don't know or not familiar with MetroHealth, Pride Network, what can you share about that?
Well, we started off about 12 years ago. Dr. Doug Van Auken, who is now retired, set up an LGBT clinic, and it was housed in the McCafferty Center in a lower income neighborhood. And we served patients there for that many years. Well, just before COVID hit, the city was planning on closing the building down. And so we have expanded to various other clinics. We actually have a clinic in the LGBT Center now in Gordon Square in Cleveland. We have facilities in Rocky River, in Middleburg Heights, Brecksville, Old Brooklyn, Cleveland Heights. We added, I'm so excited, we added 4 new providers this year.
Wow.
One was resident in internal medicine pediatrics. One was a graduate of the family practice department, and 2 were individuals from Pennsylvania that were looking for a clinic that they could expand with. And so, yeah, we have, and right now we are basically equal. Well, we have 3 male physicians and 3 female physicians. I'm sorry, 4 female physicians, because we also have one in Brecksville too. So,
so if there's even if there's like a patient or somebody who knows somebody, who may benefit from your services, what kind of services, does your clinic provide there?
Well, primary care, we provide everything for LGBT. We provide the basic family practice screening program, well woman exams, cholesterol, immunizations. For LGBT, we do deal with PrEP, and I can talk about that more because every family doctor should know about PrEP and should.
Yeah, why don't you go into that right now? What PrEP is and why family medicine needs to know that.
So PrEP is taking a medication every day, and it prevents a person from converting to HIV or AIDS. There are 2 medicines out there, Truvada and Descovy. They both have a very good effectiveness. Descovy is a little easier on the kidneys, and a person takes them once a day. We do a follow-up every 3 months to check kidney functions and to do any STD testing that may need to be done at that point, and just to see how the person's doing. We do this in an area of also recommending other barrier methods and other ways of having sex safely to prevent disease spread. The reason I think every family doctor should do it is because there's a lot of people out there that are having sex, and we could really prevent HIV transmission by doing more and more PrEP. It's, again, during COVID, some of my patients have decided to quit, some are continuing on it, the vast majority of them do quite well on it. So the CDC recommends a visit every 3 months, and you do an HIV test and check kidney functions. Every 6 months for STD checking. Now, we tend to do it a little bit more frequently in our clinic because we ask our patients, what are you doing for sexual behaviors? Or what parts of your body are you using? Let's make sure we culture those. And one of the wonderful things that I think we're doing with our clinic is we're picking up asymptomatic STDs. So we're treating these people so they're not spreading things out to the regular community too. So it's just, I think it's a win-win situation all around.
Great. So I think I cut you off before. So what other services other than PrEP in those clinics? Well,
besides the basic primary care stuff, we also do transgender hormone therapy for those that wish to have additional help with transitioning. We have a great behavioral health program. We also offer Kids Pride program. We have a wonderful physician, Dr. Ajua Davis, who is a pediatric endocrinologist, and a terrific, a ped psychological program that's just wonderful for evaluation. We also have surgeons that will do top surgeries for our trans guys, and we have OB-GYNs that will at least do hysterectomies for the guys that want to do that. We right now use a physician at Cleveland Clinic for vaginoplasties for the women that want that, and that's again how we work together, this population. But I think the main thing is we offer them a safe space that they can come in and tell us whatever they want to tell us. I had a patient recently that said it's so nice to have a patient that understands, or a physician that understands gay patients, because I can tell you anything. And it's like, yeah, please, you should be able to tell me anything. And if I don't know the answer, I'll find it out for you. So
and you probably get a lot of questions, at the clinic as far as, insurance coverage for things like PrEP and medical therapy and surgical therapy for transitioning and things. How do you respond to that?
Well, Metro is under an umbrella of I don't know what the initials are offhand. I should, but it's part of the county health department, and so we have very low costs for our hormone replacement or hormone therapy. Most insurance though are pretty good about it. Sometimes it's a little bit of a struggle with the form that we give, but again, like I said, Metro we usually can take care of them pretty well for that. As far as the surgeries are concerned, we have a ways to go medically yet on that. It's still considered cosmetic in many cases, especially like the facial surgeries or the Adam's apple reduction. Um, I think a lot of it is for our transgender individuals. It's very much in the infancy. A lot of my patients, when they come out to their parents are, can't you just be a lesbian or a gay guy? Because the parent, which no one would have said 30 years ago, but for the parents, they can wrap their heads around that.
Right.
They can't quite understand, okay, now I need to call you a new name and a new pronouns, and you're not going to be my little girl, my little boy anymore. It's a bit more of a struggle. So
Sure.
we're also hoping to start, and again, when COVID is over, I want to pursue this more, we do have a few transgender support groups through the center, but I'd really like to do that more, like PFLAG. PFLAG is Parents and Friends of Lesbians and Gays. And that's a good start, but the transgender community is quite different in what they face and what they experience. And I really want to get something like TFLAG, to just steal a name from, that we can help people with their issues.
Now, you just kind of mentioned it in passing, but I mean, your clinic is like other clinics. They've been affected by coronavirus, COVID. How has COVID affected your clinics and your work?
Well, the biggest thing about it is, of course, we're not doing face-to-face. We're doing telemedicine and video visits. For many of our, especially transgender patients, it's a boon because a lot of them live south of Canton. Some are driving 4.5 hours to come see us. And so the fact that we can find a lab near them where they can get blood work done if need be, and then we can just do a telephone or a video visit, it's really a savings for them. They don't have to drive. They don't, depending on the weather or whatever like that. For the PrEP patients, since we do a lot of blood testing and cultures, we're getting more creative with those. And as I'm sure you know, Mike, I mean, there's nothing like sitting in a room with a patient. And one of the hardest parts right now is not being able to, hug the patient or touch them. Some of these patients are going through just horrendous things with family, friends, work, society in general, and you just want to give them a big hug because they really need that.
Has it been difficult to follow these patients, or do you lose some of them in follow up just because of this whole coronavirus thing, or how's that been?
Well, especially with our trans patients, because there's a lot of homelessness, so it's sometimes more difficult to get in touch with them at times. Thank goodness for cell phones. That really helps keep a lot of people connected with each other. But there are articles being written now that, especially in the transgender population, there's a higher risk of self-harm coming out of COVID, higher degrees of depression, anxiety. There was an article written in Cleveland about a guy who he was at a dorm at Cleveland State that was special diversity for trans patients. They, of course, closed the building because the campus was closing, and he had to go home to his parents, who are not very accepting of him and not really keen on the whole transition. So he's suddenly thrust into this environment, trying to do his degree, trying to do his studies with parents that are struggling to support him best.
And you have patients from all over the state or all over the region. I'm like, how far is the outreach of your clinic, or even of the clinics in Cleveland in general?
Well, Metro has a very long record, and a lot of the spread is the word of mouth. I used to claim that I had the patient that came the farthest, and he came from Macon, Georgia. His family lived in Cleveland. He would come up twice a year for his blood work and for refills of his medications, because, of course, testosterone is a controlled substance, and so we need to see them on a more frequent basis. But we have people from the Pittsburgh area, from West Virginia. We have a number of people from Dayton that will drive past Columbus, which is developing its own program, and come to us. Michigan, Indiana, Illinois. I mean, it's really quite amazing. when you offer a space that's safe for people and where they feel comfortable, they'll do what they can to get there. And that's, again, where telemedicine has been very helpful for these people that live like in Southern Ohio. We can do telemedicine. They don't have to worry about driving to see us and still get the care that we can give them.
I think you mentioned before the show, I mean, I think, are your clinics, some are going to be temporarily shut down because of COVID, or what is that situation like?
Well, since Cuyahoga County is nearing purple at this point, Metro has decided to close some of the smaller clinics because of staffing, so that we have staffing available for the main hospital. So my clinic in Rocky River will be closed probably through the end of January. They're predicting at this point, but again, we don't know. Depends on the numbers. And our Brooklyn clinic is closed. Our clinic in the LGBT center is still remaining open. Dr. Allison Myers, who runs that clinic, says as long as they will keep the doors open, she's going to see patients there. It does mean we have to contact these people, and a lot of them they have to be transferred to telephone or video visits, but at least we can still touch base with them. And
so even though the physical clinic is closed, I mean, they're kind of shifting towards virtual visits or telemedicine. Is that right?
That is correct. Like I said, our main hub that this clinic started in was McCafferty Center, and it closed by plan, not due to COVID. And unfortunately, a lot of people in the greater Cleveland community and Ohio and surrounding states thought our program had closed completely. So we're trying to get the word out there that no, we are still open. We actually added all these providers on, so we have a lot of availability for people who want to see us.
Great. So as we're kind of starting to wind down our chat and our interview, are there resources out there that family docs or other people can, since you said there's not any special certification that you need, but maybe just some resources that family doctors can kind of look to?
Well, the American Academy of Family Physicians has great information, as everyone should know by now. It's always good to go out there and read up on it. There's also the USCF website right there below us, the Centers for Excellence in Transgender Care. For a doctor maybe in a rural area who they don't feel comfortable taking care of the patient, they can at least read up there and get an understanding of what goes on. One of the things that still drives me crazy, even in a larger city, is patients that will show up in the emergency room on Descovy, which we use for prevention of HIV. And the staff will ask them, well, how long have you been HIV positive? And the patient's like, when did I turn HIV positive? They're like, well, you're on this medicine, so you must have HIV. It's like, no, it's preventative. Or the transgender individual that shows up for a cold or a sinus infection, and the doctor's saying, well, I don't know how to prescribe antibiotics because I don't know how that'll interfere with the medicines that you're on.
Right.
Like, blood pressure meds or something like that, we should understand how interactions occur. The Center for Excellence in Transgender Healthcare, or the website that she's right there, will really give you some great information. And also stuff to help. I remember this one patient, as they were going through transition, said that one of the problems was they were having a hard time maintaining an erection. And I said, well, you were on androgen blockers and estrogen. And I said, talk to your endocrinologist about it. I now know that we can try things like Viagra, Levitra, if that's what they still want to use to have sexual encounters with other individuals. So, and it doesn't diminish their transition.
And I think you said also MetroHealth itself does have some resources as well, or?
They do. We have a website, and we're continuing to update it. Right there. Yes, you could. And we also actually have started up a Zoom group. Of course, everything's Zoom now, of patients and providers, so that we can continue to get feedback, so we can continue to improve how we communicate with people, how we can make sure we care for them. But that website there's a number there. So if someone is interested in being seen by one of our private providers, they can call that number, and it goes to a special group of operators that know our clinics and know the providers, and so should be able to get them in fairly quickly.
Wow. I mean, it's just I mean, Mark, it's a very important topic. I know you're very passionate about it. As we start to kind of wind things down on our interview, I mean, people can hear the passion in your voice, and they know that the work that you're doing. But as we're kind of closing things up, I mean, I'd want you to share with our audience again, why you think that care for this population is very important, and why this work is so important to you.
Well, I went into medicine like most of us did, to take care of people, and this population has a lot of different struggles. Not saying other populations don't, but they tend to have more homelessness. They have a tendency to be lower income, lack of health insurance. They're maybe thrown out of their church and their work and their family and their friends, and they're isolated. So providing a space where they can come and feel comfortable and cry or laugh and just get the care, have someone listen to them and help direct them to, okay, let's get you into this person to help talk and work with that. And yeah, because it's just been a bit of a misunderstood population. And in the LGB part of this community, I'm not sure that they fully understand it any more than the straight people do on the other side. It's because there's a big difference between sexual orientation and gender identification. Because some of my patients who are going through transition say they're transitioning to a woman. They're like, but I still like having sex with women. So what does that make me? I'm like, well, in our society, we use the label lesbian. But I think we just love who you love. So you can just accept that as that. And that's hard for a lot of people to wrap their heads around. Well, if you're a woman, why don't you want to be with men? And, so I think there's a lot of education that we can do with this population.
Yeah, I definitely agree, Mark, and it's just with conversations with you and conversations with advocates and has really helped my education on this topic. I have patients who, talk to me about some of these topics. I admit that, in past years, I have been uncomfortable just because I have not been familiar with the needs of that community. Just like, I'm maybe not familiar with the needs of other type of communities until I start to have that dialogue, to start to have those conversations with people who deal with those communities more than I do. And it is conversations like that. It is more conversations like this that I really hope happen, so we can, help the needs of these communities, because it's so very important. And I want to thank you for the work that you're doing. I want to thank you for the leadership that you're having with this, because it's just stuff that I don't know about, and I know it's stuff that a lot of family docs don't know about, and when they don't know about it, they're afraid of it. But they shouldn't be afraid of it. They should, be curious about it. They should engage in conversation, and that's how we can kind of break down some of these walls.
That's it exactly. There's so many things mixed in with this. Lack of preventative care, fear of doctors. A lot of patients have been mistreated by physicians. Just discomfort of walking in and not knowing. We always tell our students, if you're not sure, ask what pronouns they want to use, and try to stick to those. My biggest issue is I'm a Midwest guy, so I always say you guys.
Yeah, me too. Yeah, exactly right.
Because we grew up, and so I'm trying to change over to y'all, which is a very kind of cute, kind of quaint, but it's also a very gender neutral way of
right. But it's tough. It's tough for a Midwestern guy to say y'all, because that has its own things.
Exactly.
So, Dr. Mark McLoney, thank you so much for being here, Medical Director for MetroHealth. We will share these links, out on OAFP channels and websites and that type of thing. Thank you so much for being here, Mark.
You're very welcome. If anybody has any questions, we again with COVID, we aren't able to have people shadow us all the time, but I would hope in the future that we would be able to do that, and also maybe eventually offer it to residents, even so that, and from around the United States, so that they can get that experience.
Great.
knowing this population and being comfortable with it, just getting to know them, because they are an amazing population. Just
Yes.
they're just terrific folks. They're all terrific folks.
I'm slowly learning that. I'm slowly learning, to appreciate everybody. So, but yeah, thank you for being here. And just to let the audience know, this is the last bite-sized learning for this year. You can see all of them at our website, ohioafp.org. And yes, I'll be back in the new year talking with great people like Mark, Dr. McLoney here. But till then, review all the other interviews here, and you can catch them all at ohioafp.org. And that ends our program tonight. So thank you, everybody, for being here, and happy holidays. And hey, have a good one, Mark. We'll see you later.
Hey, thanks, Mike, for doing all this. You bet. Have a good holiday.